Welcome to the Untethered Airway podcast, where airway health meets real-life impact. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
And we're the moms and airway-focused dentists who founded the Untethered Airway-Center. On this podcast, we're pulling back the curtain on the root causes of breathing and sleep challenges,
helping families and fellow providers understand how airway-focused care can change lives.
Because it's not just about teeth, it's about total body health.
Let's dive in.
Hello, welcome to the Untethered Airway podcast. I'm Dr. Meggie Graham. Today I'm sharing a story that reflects what we see all the time in our practices, one that highlights why early airway intervention matters and how easily things can be overlooked when the signs are really subtle and not overt. If you're a parent, a provider, if you're somebody that's just curious about how breathing and growth are connected, this episode is for you. So let's dive in. This is the kind of story that I hear about or see every single day. It's exactly why I care so much about what we do and why I care about raising awareness. There are so many kids out there that are quietly struggling and their families are being told that it's normal, there's nothing wrong. And these aren't rare cases. They're really common. And if we can help parents see these signs earlier, we can make such a huge difference in these kids' lives, these families' lives, and also their overall health trajectory. So let me tell you about one of those stories. This little girl, Nora, is one of my favorites. She was just darling. She came to see me right after she turned 5. Her mom had been doing some online research and ended up finding our office. She had concerns about Nora's sleep. They had just gotten back from a family vacation where they shared a hotel room, and for the first time in a long time, Mom was sleeping next to Nora, and she noticed that she had the light snore and she heard her grinding her teeth, and it just was an alarm for her. It was alarming to her, and so she got home and she made an appointment with both the pediatrician and the pediatric dentist. They both basically told her that it was normal. Don't worry about it. Nora will grow out of it. You're overthinking this. She also mentioned that she had talked to the pediatrician about the fact that Nora still wore pull-ups at night because she was still bedwetting. And the doctor said the same thing. Some kids are just later to nighttime potty training. She'll be fine. Don't worry about it. But Mom couldn't shake this feeling that something was off. And so she trusted her gut, and she did the online digging and then eventually made a consult with us. So they came in for their first appointment, and I started my observation as they were walking into the operatory. I always do that because I think I can gather quite a bit of information just observing before they know that I'm examining them. So I look for things like posture. Is their mouth open? Do they have dark circles under their eyes? These are the things that I'm looking at before I even put my gloves on. So Nora sat down. I did a clinical head and neck exam, and I did prescribe a 3-dimensional x-ray or a CBCT so that I could look at her anatomy more closely beyond what I could see with my eyes in the chair. Clinically, her tonsils were big. They weren't touching, they weren't kissing tonsils, but they were pretty large and very red when I looked at the back of her throat. When I took the CT scan, her adenoids were alarming. They were so big, and you can't see the adenoids clinically. They're behind our nasal passageway at the top of the nasopharynx. And on the x-ray, they were so large that her airway was almost completely obstructed. So she really couldn't breathe through her nose. Even though she didn't have her mouth wide open, her lips were constantly parted, her lips were chapped. And looking at that x-ray, it made sense as to why. Back to clinically, I noticed that her dental arches, her upper jaw and her lower jaw were really narrow. She had only her baby teeth. She didn't have any permanent teeth, and there was no spacing at all. All of the baby teeth were touching, nice and straight and tight, but that's actually a concern, and that diagnosis is dental crowding, even though they don't look crowded. Because if you think about the permanent teeth that are going to come in after the baby teeth, they're so much bigger. So if there's no spacing around baby teeth, that's alarming. Her palate, or the roof of her mouth, was not only narrow, it was really vaulted. It looks kind of like if you took a thumb and pushed it into clay. It's tiny and narrow and deep. So those are the things that I noticed during the exam. She did have dark circles under her eyes. She just looked tired. She looked drained, like how I feel after one of my kids has a bad night and I'm up with them. She just didn't seem very rested. She was engaging. She answered questions. Her behavior was great. She was actually kind of funny, but she just seemed tired. The tricky part was that she wasn't having huge behavioral issues. She wasn't having phone calls home from the teacher telling telling mom and dad that she was getting into trouble. She wasn't hyperactive. Her school reports was that she was doing fine academically in her first year at kindergarten. So from the outside, nothing screamed problem. And that's exactly why this is so easy to miss. Another thing that mom shared with me was that she constantly caught colds. And while it wasn't really dramatic, she had sniffles all the time. And the pediatrician actually dismissed that as well, saying, well, that's pretty common when kids are in daycare or early grade school. They will catch each other's colds and they'll constantly be sick. And while that can be true, mom felt like she was more susceptible compared to her siblings and compared to her cousins. She just added that to her list of things that she was worried about. Mom said that during the day, she never noticed her mouth being wide open, which is what I noticed when she walked in, but her lips were always parted. I actually pointed that out to mom. Mom hadn't noticed that her lips were parted. She said at night, she noticed that her mouth was wide open, and she reported that Nora slept in really funny positions. Her head was always craned or her neck was craned, and she would vacillate between her mouth being wide open or grinding. She didn't report any night terrors or interruptions in her sleep. She never interrupted mom and dad. She would go to bed and then mom wouldn't see her again until the morning. And so mom reported that as a good sleeper. She had friends that had kids that were up all the time and really went through major behavioral things at sleep. So she was not concerned about Nora's sleep in general, but she did start to think that the quality might not be as good as it could be. So all of those quiet signs we were gathering from her story, from my observations, they were telling us a much bigger story. I also asked mom about her early feeding history. She said at first that there weren't really any big issues. She was never anything but average on the growth curve. But when I asked a little bit more about breastfeeding versus bottle feeding, she did say that while her goal had been to nurse Nora for a year, she stopped after 3 months because Nora seemed really frustrated on the breast. She just couldn't get enough milk, and she constantly needed to supplement breastfeeding with bottles, and so they just gave up after a couple months and just decided that it didn't work for them. And that actually makes a lot of sense when we looked at her oral function. During the exam, I noticed that she could stick her tongue out. She couldn't lift it up though. On the TRMR scale, which is a scale that we use to measure ankyloglossia or tongue mobility, she was a grade 3. She was compensating the lift of her tongue by using other floor of the mouth muscles. We see that very commonly where children and adults will learn how to compensate dysfunctionally to make their tongue do the thing it can't do on its own when it can't move fully because of a short lingual frenum or a tongue tie. And that starts this whole system of body adaptations that will change the way somebody grows. It also can and will affect milk supply. If the baby can't transfer milk efficiently, the breast doesn't get the signal to keep producing milk, and so supply drops, and the baby ends up relying more on bottles, which are often easier to drink, and they don't always require the appropriate tongue and muscle function. So that part of the story was interesting to me. Like I said, she didn't have any weight gain issues, but that low tongue posture and the chronic mouth breathing were contributing to this cycle of inflammation, congestion, illness, repeat. And she wasn't breathing through her nose, which meant that she wasn't getting the benefits of nasal breathing like filtered air and nitric oxide production. So every little cold lingered and every illness made it worse and just seemed to perpetuate and become this constant norm for her. It's so easy to dismiss all of this. She's just a picky eater. She just gets germs at daycare. All the stuff you hear all the time, those are things that are just being told over and over again and make this awareness even harder and more important. But now we had this objective 3-dimensional scan, and we saw how blocked her airways were. We saw how narrow her roof of the mouth was and the floor of the nose. I sent her to an ear, nose, and throat doctor that I really trust, someone who gets that we're not trying to overtreat, but we also don't want to just sit back and let things slide, especially when neurodevelopment is so important at this age, sleep quality is so important. He got her into the OR really quickly, and they removed the adenoids. They did a drug-induced sleep endoscopy while she was under anesthesia, and they noted that her tonsils really weren't obstructing, and so they chose to leave them behind and just remove the adenoid. After she had healed, in our office, we made a custom expander for her maxilla. We had it fit on her baby molars. Another thing that we'll hear often is that dentists or orthodontists will tell the family to come back when all of the permanent teeth are in, and that we can't do anything on the primary dentition or on the baby teeth, and that's just not the case. If the child needs the treatment and they can tolerate the treatment, we can certainly put expanders on baby molars. In fact, there's research that says that that's actually better long-term from a periodontal or gum and bone perspective. So in about 6 weeks, we were able to widen her palate, not just tip her teeth, but really widen her palate and create real space for her tongue. And by widening the palate, roof of the mouth, we were also widening the floor of the nose. And so nasal breathing became easier, not just because the adenoids were no longer obstructing, she had more space for air to flow through her nose. And we actually used Invisalign first on the lower arch and uprighted the lower teeth because they were so lingually or tipped in to meet this upper arch that was so small. So all of that was really quick and pretty non-invasive. Nora tolerated it really well. When we were all done with phase 1 or that expansion, we moved right into myofunctional therapy, which I think is the most important part. The therapist helped her unlearn all of those muscle compensations, all of the things that she had been doing her whole life so far. She unlearned those dysfunctions and learned how to use her tongue the right way and stop using her other muscles. It definitely took consistency, and Mom was very committed, but the therapist and Mom made it really fun. They made games out of it. She had stickers and progress charts, and we had prizes for her. It was a really advantageous therapy, and they saw improvement even before we got to doing a tongue tie release, which was part of her treatment. Mom also at this point said that she had a little bit of a speech delay, nothing major, but she kind of garbled sometimes, and it wasn't something that jumped out to her until it went away. And when we were doing the myofunctional therapy, even before she had the tongue tie release, Mom noticed that her speech was more articulate and clearer. So eventually we did do a functional frenuloplasty or tongue tie release when we couldn't make any more progress with the myofunctional therapy because her tongue was stuck. So we did the release, and then she continued on with the therapy now to learn how to use her muscle now that it had full mobility. The gains were huge. It was just such a fun progression to watch. And that was the end of the story, right? We saw her, she went to the ear, nose, and throat doctor, we expanded her maxilla, she did myofunctional therapy, had a tongue tie release, went on for myofunctional therapy. And then time went on, and we lost track of her. And just recently, and this is the reason that the story has come back to the forefront of my brain, Mom came back in with her younger son, who's now 4. He doesn't have any major symptoms, but she sees some of the same growth patterns that we uncovered with Nora, and she wants to be even more proactive this time. And I was able to ask her how Nora was doing. She's almost 7 now. And Mom was really emotional when we talked. I got goosebumps. It was beautiful. She had tears in her eyes, and she just said that Nora is thriving. She's doing so well. She's not sick ever. She doesn't get sick all the time. In fact, Mom said, I can't remember the last time she had even a cold. She stopped bedwetting I think during or right after we finished expansion. She said that she's just healthier. She just looks more alive. People comment on her broad smile. And Mom was just so excited to share that news with us. And Mom also shared with me that she has a friend in another state that casually was telling her that her 7-year-old daughter had just seen a dentist who sent her to the orthodontist because of crowding, and the orthodontist was saying, we need to start to take out baby teeth. And Mom was like, no, don't do that. Maybe you can make the mouth bigger and make room for the teeth. So going through this process as the parent, she now gets to be an advocate because she's seen such amazing results in her own daughter, and that ripple effect keeps going and is going to impact other families too. So this story is not unusual. It's not a one-off. I see versions of this every single day, and that's why I care so much about this work. We get to change lives early, before chronic fatigue, before systemic issues show up, before behavioral things become stigma and change their academic trajectory. And even before invasive dental work is needed, we get to jump in and help. And of course, I love treating adults. It's a huge part of our practice. While they can live with all of these things, they can suffer with it. They suffer with it. And the earlier that we can step in and support healthy growth, the better the outcomes are for the patient and for the whole family. While I love treating adults, and we do all the time, treating a 5-year-old like this and catching it early, that's where the real impact happens. I love sharing this story with you. I can talk so much more about the details of the case, but I just really wanted to share the overarching view of what we see every day and how it really had major impact on not only the structure and not only the health, but on this little girl's well-being in her whole life. Thank you for joining me today. Feel free to add comments and ask questions and follow along. Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this, and don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @Untethered Airway.
Until next time, bye!